Hey everyone, so let's do a little bit of a Mythbusters challenge today. So let's talk about the differences between a mini tummy tuck and a traditional tummy tuck or abdominoplasty. Now, what most people would think based on the term mini, or a lot of people do believe, is that a mini tummy tuck is less than or a minimal procedure versus a traditional tummy tuck, which is absolutely false. What mini refers to is really just the length of the lower incision. So in a traditional tummy tuck, we're using a full length incision, and a mini tummy tuck a little bit larger than like a C-section incision. So in a traditional, we're actually going out further, which lets us get more tissue. The hallmark really of any tummy tuck procedure is the fact that we're going in and tightening the muscles. We're literally suturing it together and pulling it in like you're tightening your shoelaces or pulling a corset together. And that's done here in the middle, where we're really defining that narrower waistline, contrasting it with the upper chest and the wider hips. So in both procedures, we're cutting away some of this lower abdominal tissue. However, in a mini, you can see we're only really cutting away this lower part, which lets us access and access the abdominal wall. In a traditional tummy tuck, we're going much higher and able to get out all of this lower skin. So if you have stretch marks, also called striae, or kind of that excess lower abdominal skin, which most patients do, the traditional tummy tuck is going to be a little bit more powerful. One of the additional differences is in a traditional tummy tuck, you make a small little fine incision around the belly button, which lets us pull this tissue down kind of like a window shade. In a mini tummy tuck, you're actually not making that incision, but the belly button goes a little bit down. So if you already have a really low belly button, you may not be the best candidate for a mini tummy tuck. The biggest difference between a mini and a traditional tummy tuck, which really determines whether or not you're a candidate, is how much laxity you have on the upper part of your abdomen. So you can see here, the more that you're pulling, and when we're moving where the belly button is, you're able to get a lot more laxity out. So when you bend over and there's laxity up here, you're probably not the best candidate for a mini tummy tuck. So those are really the key differences and the key commonalities, as well as kind of who's a candidate for that. So this is really something that you can kind of get an idea of at your home or by yourself, but it's really important to come in and see a board certified plastic surgeon to help assess that. This is also something that we can easily combine with breast procedures or other skin tightening or lasers in a full mommy makeover procedure. Have a great one.